The establishment of the 988 hotline is an important step in ensuring that individuals facing a mental health crisis receive the help they need and begin the path to recovery. And I want to join my colleagues in thanking Assemblywoman Gunther and Senator Baruch for helping us begin this first very important step. However, we must do more to ensure there is an adequate mental health care workforce to support that growing need. A call for help during a crisis is of little use when there is no one available to answer the call. New York's mental health system is facing a growing workforce shortage, a problem not created by the pandemic, but certainly made worse over the past year. These are rewarding but difficult jobs, and our workforce deserves to make a living wage. When New York State created these programs in the 1980s, our staff were making double the minimum wage at that time. Today, our staff are making just at minimum wage, even though the job has become much harder than it was 40 years ago. For example, rather than managing 1 or 2 medications per resident, staff are helping residents manage a dozen or more daily medications. Our staff continued to show up during the pandemic, working extra shifts to keep programs open, despite risk to their health and that of their family. As a result of the low pay and demanding work, our community-based mental health care housing providers are facing a significant staff shortage, which has led to the temporary closure of some programs at a time when they are needed the most. Last October, our members faced a 25% staff unavailability rate statewide, meaning 1 in 4 staff were not available to work. We are hearing from our members that the situation has gotten worse since that time. For example, in one large licensed residence of about 60 people, typically there are 3 to 4 case managers on staff. Today, this residence has 0 case managers on staff. A similar residence has just 1 case manager rather than 3 or 4. Another member reported a 50% vacancy rate in staff. Providers are receiving few, if any, applications for these vacancies. Folks can make more money working at a fast food restaurant or a retail store. There is growing concern that supervisors and directors will soon leave their jobs due to burnout from having to cover unfilled shifts. This week, we are beginning to gather more information from our members to gain a clearer picture of the magnitude of the workforce crisis. It is vital that things change before programs have to permanently close and mental health services diminish at a time when they are needed more than ever before. I want to thank everyone so much for coming, and particularly Assemblywoman Gunther and staff from Senator Baruch's office. Thank you so much for joining us today, and to all of our partners. We really appreciate everyone's commitment to this important work.